motherfucking morning to you, my friends. Welcome one, welcome all to my podcast, Alexandra Unfiltered, a show where we hypothesize, theorize, and analyze all about women's rights, women's wrongs, and everything in between. I am your gracious host, Alexandra Rose, a bad bee with a law degree, simply doing what I do best. Ranting, raving, whining, and complaining. And not necessarily in that order. So excited that you have joined Alexandra Unfiltered this evening. I have an excellent topic to discuss that I think dovetails beautifully with the topic we discussed last week, which was, as a gentle reminder, the feminization of poverty. Today's topic is the Black maternal health crisis in America. And yes, it is absolutely a crisis. For this episode, I will be discussing the parameters of the Black maternal health crisis. I will be defining what that crisis looks like and how different folks from different organizations at different levels throughout the medical field define that crisis in terms of numbers. I will absolutely be presenting you with stats and facts because as a bad bee with a law degree and as a bad bee with a sociology degree, I come with data. I come with receipts, and never forget, the numbers do not lie. Oh, and sorry, side note, I do have my handy dandy iPad on hand. As always, I will also again be wearing my sociology hat during this discussion. So bear with me and let's dive in. As I was saying, the Black maternal mortality rate in the United States is a critical and urgent issue. Despite advances in medical care, Black women are still disproportionately affected by complications during pregnancy and childbirth, with the statistics continuing to paint a stark and troubling picture. In today's episode of Alexandra Unfiltered, we will be exploring the stats and facts of the Black maternal health crisis, because the numbers don't lie. And we will also review the factors that contribute to these disparities, from systemic racism and healthcare inequality to the social determinants of health. Please bear in mind I have conducted thorough research into this topic, so I will be citing sources that include U.S. government agencies, academic papers published in peer-reviewed journals, studies, news articles, data from global health agencies, and more. Stay with me as I walk you down the primrose path of patriarchal pitfalls that is the Black maternal health crisis, and as we conclude the episode by briefly discussing radical, realistic, and powerful solutions to this ongoing problem. So first things first, we're going to define and outline the parameters of the Black maternal health crisis. And as with my other episodes in this podcast, I will present a few baseline definitions that I will be using throughout this episode and referencing frequently. Definition number 1, maternal morbidity. In the United States, maternal morbidity is defined by the World Health Organization as any health condition attributed to and/or aggravated by pregnancy and childbirth that has a negative impact on the woman's well-being. That's maternal morbidity. Definition 2, severe maternal morbidity. The U.S. Centers for Disease Control and Prevention define severe maternal morbidity as unexpected outcomes of labor and delivery that result in significant short or long-term consequences to a woman's health. That's severe maternal morbidity as defined by the U.S. Centers for Disease Control and Prevention. Definition number 3, and this one is broken down into a few different sub-definitions. I will be frequently using a phrase called the social determinants of health. If you are in the healthcare field, if you are in the healthcare field or if you work adjacent to healthcare, behavioral health, social work, even, maybe in the legal profession, for example, you've probably by now heard or are familiar with that phrase, the social determinants of health. And that is defined by the U.S. Department of Health and Human Services as the conditions and the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes and risks. Those are the social determinants of health. Now, you may already be asking, okay, Alex, you're dumping a whole lot of information, you're using a whole lot of big words, and we just started the freaking podcast. Can we pump the brakes for a second? We absolutely can. Because I want to break down social determinants of health, because those are grouped into 5 domains, and the domains may help you understand, give you some context for how the social determinants of health play out in your own life and what that might look and feel like for you. So those 5 domains that the social determinants of health are broken down into are economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context. Those are the 5 domains that make up the social determinants of health. So the primary domain that a lot of us can relate to is the economic stability domain, because your economics, such as your income, that domain really is kind of at the base of that pyramid, and that economic stability, or lack thereof, economic instability, is often what determines life outcomes for most Americans. And think about it, it tracks, right? If you are working a low-wage job for most of your life, your low-wage income dictates what kind of housing you have access to. It dictates what kind of healthcare, if at all, you have access to. If you are living somewhere that is also low wage, your low income zip code dictates what kind of supermarkets and groceries you have access to purchasing. It dictates how much crime is experienced in your neighborhood or in your city that you may be subject to as well. It dictates your access to a whole host of things that themselves determine how your life turns out. It determines your lifestyle and your quality of life. All right, so I want you to think about all of these things, the maternal morbidity and severe maternal morbidity as they relate to the social determinants of health, because I want you to think of all of these things as a circle, all right? These structures and these systems, as you're going to see, are interlinked. They are inextricably interlinked, meaning that you cannot separate and parse them one from the other. So for Black women in the United States, the same way that a Black woman, and I speak myself as a mixed race Black woman, the same way that as Black women, we cannot necessarily extract our race from our gender. We don't necessarily say, oh, I'm Black first before I'm a woman, or I'm a woman first before I'm Black, because those two identities are so deeply connected that just looking at one identity without examining the other identity robs us of humanity. And it makes us 2-dimensional characters when in fact we are 3-dimensional, fully fledged, complex human beings. All right, so I want you to think of that big circle of interconnected networks when we're having this discussion. And I want you to think of how Black women, our identities as Black people and as women, are inextricably linked to one another. Okay? So looking at the broad, big picture, when we're discussing the Black maternal health crisis in the United States, of course, I come with some more stats and facts, all right? The United States has the worst maternal mortality rates of any developed country in the entire world, with 26.4 deaths per 100,000 live births, according to data from the National Institutes of Health. Okay, Black women in the United States are ones who disproportionately experience adverse pregnancy outcomes, including but not limited to maternal mortality and severe maternal mortality, compared to women of other racial and ethnic groups. And that is according to the essay, Listen to the Whispers Before They Become Screams, Addressing Black Maternal Morbidity and Mortality in the United States by Njoku A. Evans M. et al., originally published in the National Library of Medicine in 2023. So I'm going to stop right there. The fact that the United States has the worst maternal mortality rates of any developed country in the world is a stark, glaring disappointment, quite frankly, because the United States spends so much time touting itself as we're the premier global superpower. We're the richest country in the world. We have the best technology. We have the best healthcare. We have the best economy. And sometimes I want to stop and ask, the best of everything for whom? Who in America has access to that best? Is that best healthcare, that best economy, that best technology? Is that widely accessible to every American? Or is it only accessible to extremely wealthy Americans at the very top of the hierarchy? Because my personal belief, from a sociologist perspective and from the perspective of a bad bee with a whole law degree, Juris Doctor, JD behind my name, I hesitate to categorize anything being the best or leading or the first if here in America, the homeless, or rather the unhoused, uneducated, disabled individual who may have mental health illnesses and certain other challenges, if that person who people say is at the bottom of the hierarchy in our society, if they do not have access to the best that America claims that it offers, then American public policy has failed, because we are failing our people, our nation, and ourselves when we say things like America leads the way in XYZ, if the basest person you know, the most disenfranchised person you can think of, does not have access, easy, unrestricted access to that resource, then that is a society that has failed. That society's public policy has failed. We are failing Black women by judging our healthcare system as being the best when Black women are dying at such high rates as they experience pregnancy and childbirth. If only certain women are the ones who get to experience and access our quote unquote best healthcare, then we don't get to call it the best. Do you understand what I'm saying? Nothing is the best. Nothing is deemed as being the greatest and the fourth, the best that we have to offer if the most disenfranchised person in our society cannot access it. And Black women, this country was built on Black women's backs. We'll be discussing too the very, very alarming racist history of gynecology and obstetrics in America, right? So let's just start there. The fact that the US has the worst maternal mortality rates of any developed country in the world. Sorry, I just had to do that sidetrack real quick. Some things that contribute to this high mortality rates among Black women in particular is the historical legacy of institutionalized racism and bias in medicine. And getting more into the weeds about some of these statistics, here in the US, Black women are 2 to 3 times more likely to die from pregnancy-related complications than white women, with most of the maternal deaths that Black women experience being deemed as preventable, according to data from the U.S. Centers for Disease Control and Prevention. In fact, 4 in 5, or about 80% of all pregnancy-related deaths in the U.S. are preventable, according to the Maternal Mortality Review Committees in 2022. So you mean to tell me, of the high rate of maternal mortality deaths in the United States, 80% of them are preventable? Like, I just blanked out right now. 80% of these deaths are preventable in America, the premier global superpower of the world, with the quote unquote best military, best healthcare, best technology, best educational systems, blah, blah, blah. Fucking joke. This all goes back to public policy. Public policy has and is continuing to fail women in the United States, and Black women in particular. The World Health Organization defines a maternal death as the death of a woman while pregnant or within 42 days of termination or pregnancy, irrespective of the duration and site of the pregnancy, from any cause related to or aggravated by the pregnancy. That's a maternal death, all right? And in fact, the U.S. Centers for Disease Control categorizes maternal mortality rates as the number of maternal deaths per 100,000 live births. Okay, so we have these parameters, right? And I'm painting this picture, leading you down this primrose path of patriarchal pitfalls, right? So that you can see how all these big words, all these definitions are linked together because these systems work hand in hand in oppressing Black pregnant women in America. So now we're diving into even more stats and facts, because I am not going to present you with theories and, just come to, present you with a topic empty-handed. I'm not going to walk up to you empty-handed with nothing to show. No, I don't do that. So stats and facts about Black maternal health in the US. In 2019, the estimated maternal mortality rate was 20.1 deaths per 100,000 live births. In other words, there were approximately 861 maternal deaths in the year 2019 alone, according to data from the U.S. Centers for Disease Control and Prevention and the essay, Listen to the Whispers Before They Scream, by Anuli and Joku et al., published in the National Library of Medicine. So in 2019, there were 861 maternal deaths in the U.S. alone. 861 women, 861 expectant mothers who were not expecting at all to die in the process of bringing their child to term, bringing their child to birth. They were full of promise, they were full of hope, and live in America, where the expectation is, if America is a preeminent global superpower, then I, as a pregnant woman in this preeminent global superpower, should have no issue or trouble doing something like, having a baby, right? In that same essay, Listen to the Whispers Before They Become Screams, the authors identified that for Black women, the maternal mortality rate in 2019 was 55.3 deaths per 100,000 live births. And do you know what that translates to in terms of plain numbers? In 2019, Black women experienced an estimated 1,800 maternal deaths in total. 1,800 pregnant Black women died in 2019 alone. 1,800 pregnant Black women who were human beings, whose lives, whose promises, whose dreams, whose hopes mattered, and they died. That's a big ass fucking number for me. I don't know about y'all. 1,800. There are towns and cities in America that don't even have 1,800 people, much less 1,800 pregnant Black women dying from maternal mortality causes in America. In 2019. That number, according to the consensus from the healthcare community, that number of Black women dying from pregnancy-related causes is just continuing to increase at a steady rate. It's alarming how this rate is continuing to increase. And of course, there are several factors associated with maternal mortality and morbidity in the U.S. These factors include hypertensive disorders of pregnancy, some big medical words here: thrombotic pulmonary embolism, hemorrhage, infection, cardiovascular conditions, cardiomyopathy, non-cardiovascular medical conditions, etc. That's according to a journal article published in a peer-reviewed article by C.J. Berg and W.M. Callahan in 1998. It's important to note, too, that some detractors who try to sort of criticize the presence of the Black maternal mortality crisis will say, well, that's on Black women. Black women can have better lifestyles. If they were eating properly, if they were exercising, if they were properly managing their stress, if they weren't participating in risky behaviors like imbibing alcohol and drugs while pregnant or leading up to pregnancy, then we wouldn't have a Black maternal mortality crisis in this country. First of all, shut the fuck up. You're mad racist, and I'll reach through this phone, through this camera, through these walls to box you in your shit. 1, 2, and 2 to disrespectfully push back against that. Medical professionals tell us that while predisposition to underlying health conditions exist, such as hypertension, diabetes, and obesity, while those underlying health conditions play a role in racial disparities and pregnancy-related deaths, even when those underlying medical conditions are not present, the racial disparities still persist. So miss me with the bullshit. Don't we remember Serena Williams, the GOAT, like the GOAT athlete, black woman athlete and tennis player, record breaking, like wall breaking, ceiling shattering Serena Williams? Didn't we all listen to her stories of how she almost died in childbirth? And Serena Williams is not only an athlete who has lifestyle practices that are the healthiest of the healthy in terms of exercise and diet. Serena Williams is also a multimillionaire who ostensibly should have access to the best healthcare, the best medical care, the best gynecological care that anyone in America can have access to, right? And she almost died giving birth to her firstborn, her daughter. So miss me with the, oh, black women could take better care of their health and that's why this is happening. Because the medical experts, the statistics, and the motherfucking facts beg to differ. Even when those underlying pre-existing health conditions are not present, the racial disparities still persist. Again, all of these systems linking up, basically holding hands, singing together to oppress black women, right? Additionally, African American women in the United States deliver a higher rate of premature and low birth weight babies than their counterparts. And we cannot ignore the role that the coronavirus pandemic has and continues to play in the Black maternal health crisis. Because research from the Centers for Infectious Disease Research and Policy have shown that maternal mortality increased by 33% after the start of the COVID-19 pandemic, and that late maternal deaths increased by 41% since the start of the COVID-19 pandemic. That's across all women across the board, including all races. Okay? And the percentage of maternal deaths, of course, was even higher among Black and Hispanic women during the early part of the COVID-19 pandemic period. In fact, according to the Centers for Infectious Disease Research and Policy, Black and Hispanic women experienced an increase of 2,374.7% in underlying cause of death codes for viral diseases, including an increase of 117.7% in diseases of the respiratory system and an increase in 72.1% in diseases of the circulatory system. So what does all that medical mumbo jumbo mean? What do all these academic ivory towered big words mean? It means that this medical system works overtime to oppress, harm, and kill Black women. It means that regardless of the era that we're in, whether we're in a pandemic or whether we're not, whether we are in an economic recession or we're not, whether we are in wartime or we're in peacetime, regardless, the one thing that this American medical establishment can agree on is that they must oppress, harm, and kill Black women, in particular, Black pregnant women. Don't forget that. Remember, these systems are interlinked. They hold hands, okay? Some examples, for example, of healthcare COVID-19 protocols and hospital-instituted labor and delivery charges that contributed to this spike in Black maternal deaths since the start of the pandemic include less familial support available in the delivery room, long wait times, provider shortages, and overall hesitancy to seek prenatal care, which affects pregnant women's mental health drastically. In fact, studies even show increases in depression and anxiety among Black and Hispanic women in particular who are pregnant. And that's according to an essay published or an essay called The Impact of the COVID-19 Pandemic on Maternal and Perinatal Health, published in 2021 by B. Kotlar and E. Gerson et al. All right, I told you, I cite my motherfucking sources. I'm a sociologist at my core, and then I'm a bad bitch with a law degree. 2-for-1 special when you're fucking with me, okay? So we have our stats and facts. We have identified parameters. We have identified definitions of words, social determinants of health, maternal mortality, severe maternal mortality. Now we have to get to the meat and potatoes of this discussion. Why are we in a Black maternal health crisis in the quote unquote wealthiest nation in the world? So there are several causes and contributing factors to the Black maternal health crisis in the United States. Recent studies have shown that social factors such as the historical exposure to racial trauma, discrimination, marginalization, systemic barriers such as systemic racism, implicit bias within the healthcare system, the possibility of being uninsured, reduced access to reproductive healthcare services, and as always, socioeconomic factors contribute to pregnancy complications for Black women and must be given utmost consideration in this discussion about the Black maternal health crisis. That is according to the U.S. Centers for Disease Control and Prevention and the American Journal of Managed Care. So think again back to that big circle. And within that circle, just imagine I want you to imagine maybe like either a flow chart or imagine, when you're brainstorming ideas for like a paper that you're about to write and you're drawing lines between words and themes and things like that. That's what I want you to think when you're thinking about how all of these systems, how all of this history, how these social determinants of health and these pandemics and our economy link and work together in oppressing Black pregnant women. Because where a Black pregnant woman might think that she can seek reprieve based on her income, systemic and institutionalized racism and implicit bias shoot her down. Please see Serena Williams. Please also see Queen Beyonce as well, who has been very open about her experiences in pregnancy for all three of her children. So those women, by virtue of their income, think that they could be safe, and even they are not. Then you have women like myself who perhaps we do not have the income of Beyonce and Serena. However, I am college educated. So I have, by that thing alone, I should have awareness, right, of these systems. I should know how to work around these things. I should know what kinds of questions to ask when I'm at the doctor. I don't have problems reading through my own medical paperwork because I'm college educated and can parse through complex medical terms. By virtue of my education, statistics say that I have more confidence when I'm in certain environments, so I don't present as someone who can be taken advantage of or someone who can be pushed around. And what our discussion here is showing is that even my education cannot protect me from the implicit bias within the healthcare system and from institutionalized systemic racism. So if you are a pregnant Black woman, what this country is basically telling you is neither your education nor your income can stop this from happening, because generally we just don't give a fuck. Right? And then this is the same motherfucking country that flies into a panic anytime they release census data that says the birth rate is dropping. Is it Uchiwali or is it one mic? Okay, which one is it? Do you want people to have children? Then you need to put protections in place so that everyone, including and especially Black women, can have safe, healthy pregnancies and childbirth outcomes. Don't expect us to have widespread access to all this information, all this data, all these big ass words, and expect that Black women everywhere who may be listening to this podcast or watching this YouTube episode are going to sit back and think, you know what, maybe I shouldn't have children. Or you know what, maybe I have one or two, I'm going to stop there. And then by the same token, complain that those same Black women are not having children. Stop it. Stop it. Okay? The social determinants of health, remember that phrase that we talked about earlier? Those social determinants show that poor maternal outcomes for Black individuals are caused by factors of racism that are embedded in healthcare and affect marginalized groups of individuals disproportionately. And that's again based on that essay, Listen to the Whispers Before They Become Screams, published in the National Library of Medicine. Based on socioeconomic status, race, age, and other identifying factors, the health disparities amongst individuals and communities that lack resources and education is exacerbated and continues to expand the gap in access to equitable health. So what did we talk about? I said the social determinants of health are broken down into 5 domains, and the very first domain listed was economic status. It all boils back to the money. Okay, I want you to think about this. When I sit here and spend time on like my TikTok page talking about employers in America and how they like to fuck around and not pay us or want to pay us as minimal as possible while getting the most work out of us and making money off of our labor. I want you to think about that, not just in terms of you not getting the pay that you deserve or that you're worth or that you again, deserve. I want you to think about what that also means in the bigger picture, what that also means for your overall quality of life, right? So if an employer knows that you should be earning XYZ to either match the rate of inflation or to match the cost of living or to match your skills or your education or your training, and they're not paying you that, and you're being underpaid, and you're struggling to make ends meet, you're robbing Peter to pay Paul, you're always on the brink of financial disaster, you can never save to weather a financial shock or anything like that, you don't have that many assets to your name, you rent everything, you lease your car because that's what you can afford, so you don't own anything outright. Think about that. That's what that means when that employer isn't paying you. Think about how that affects your quality of life, the kind of food that you can buy at the grocery store. It impacts how often you can go grocery shopping. We all know that healthier foods like produce and vegetables and fruits and organic things are always more expensive and cost more, and they spoil faster. So as soon as you buy them, you need to consume them, right? All of those systems work together to oppress Black pregnant women because we all work, right? And we all have to live somewhere, right? So if Black women earn, I believe the statistic from the episode last week was like Black women earn 64 cents for every $1 earned by non-Hispanic white men. So if Black women are earning almost half of what everyone else is earning, then Black women have lower quality of life as a result. So think about how these systems, again, are interlinking and holding hands, right? We're oppressed as laborers and wage earners. Then your race and your gender act as, further oppressors on you. They know what I say that to say that the people in charge of making these decisions know exactly what the fuck they're doing when they're not paying Black women. They know exactly what the fuck they're doing when they're denying loans to Black women to either become entrepreneurs or homeowners. They know what they're preventing you from being able to access by not giving you access to the money. They know that you're likely going to have a lower quality of life and experience illness, sickness, or even death as a result of not having access to that money that other people have access to. It is intentional, and that's exactly what makes it insidious. And that's exactly why I say public policy has failed and is continuing to fail Black women. Another big issue that researchers are experiencing or acknowledging here in America is that Black women, by and large, lack accessibility to maternal care. In fact, according to the Associated Press, more than 2.2 million American women of childbearing age live in what are classified as maternity care deserts. And another 4.8 million women reside in counties with limited access to maternity care. The Associated Press goes on to define a maternity care desert as a county with no hospitals that provide obstetric care, no birth centers, no certified midwives, and no obstetrician or gynecologist. Further data shows that anywhere between 45 to 60% of Black women in the United States who are of childbearing age live in maternity care deserts. So what did I say? All of these systems work together. So we discussed, I just touched on how employment and labor law and those systems and how corporate America and really any job in America works to oppress Black women by paying us the lowest wages, despite the fact that Black women are, I think, by gender and by race, some of the highest educated people in the entire country, and yet we're still some of the lowest paid, right? So our lack of higher income impacts our ability to access vital resources. Then the medical industry, big pharma or what have you, joins in on the oppression, linking hands with employment and labor law, and says, oh, by the way, since Black women can't afford to provide certain resources for themselves because we pay them shit, how about the places where Black women live, we're going to agree that we don't build maternity care centers in those places. Yeah. So wherever Black women are clustered and live in high numbers, how about we make those places maternity care deserts? We don't prioritize building hospitals or birthing centers in those places where Black women are largely clustered. Yeah. Let's do that. That's exactly how they have these discussions. I promise you that's how they talk. Okay, and they couch it in such insidious word salad language. Oh, well, the reason why we don't have a hospital branch in that county or that location, the numbers show that we would have such low patient population. It's not worth the investment. There's high crime in the area. Shut the fuck up. Shut up. Okay, so think about the interlinking and the connection of all these systems, right? Another major thing that we have to reckon with is the dark history of how obstetrics and gynecology began here in America, a history I myself was not aware of. According to Deirdre Cooper Owens, a historian and author, the history of the medical branch of gynecology and obstetrics in America began on a slave farm in Alabama because reproductive surgeries that were experimental at the time of enslavement were commonly performed on enslaved Black women without anesthesia, without medical aids, and without infection prevention measures. In fact, the physicians, like the once heralded J. Marion Sims, the Alabama doctor that many call the father of gynecology, performed torturous surgical experiments on enslaved Black women in the 1840s. So you mean to tell me that gynecology and obstetrics was first experimented upon on enslaved Black women in the United States, and that's how that medical profession started? On the bodies, on the bones, on the blood of enslaved Black women. And this is information that is now becoming widely known. I graduated from law school in 2020. That's when my law degree was conferred, and graduated from undergrad at Michigan State in 2016. So that's pretty recent, right? Why the fuck was I never taught this? Hello. And I went to school here in the United States. I graduated, I went to college during the Obama administration. That was just the other fucking day, guys. And I went to law school during the first Trump administration, guys. Why was I, and a woman who was educated here in the United States in the 21st century, why was I not given that information? And my undergraduate degree was in sociology. I took several women's and gender studies classes, and I minored in anthropology. And this information isn't widely disseminated at the university level, and certainly not widely disseminated at the public school level in high school, middle school, or elementary school. That gynecology and obstetrics in America began as unmedicated, unanesthesia practice on enslaved Black women, who, as we know, enslaved Black women definitely did not provide their consent to be subjected to those torturous procedures. And then they have the nerve to call this motherfucker J. Marion Sims the father of gynecology. Isn't that so motherfucking ironic? A man is the one who gets credit for founding gynecology by practicing torture on enslaved Black women. Isn't that something? This is America though, so that tracks. And it really makes you wonder how many other industries, professions, or fields here in the United States were founded on the bodies of enslaved Black people that we don't know about, but they do. What did Kendrick Lamar say? That they're not like us? Healthcare segregation also plays a major role in the racial health gap that is still experienced today. In fact, until Congress passed the Civil Rights Act of 1964, Black families were barred from the well-funded white hospitals, and as a result received limited, poor, and inhumane medical treatment. Black-led clinics and doctors at the time worked hard to fill in these gaps, but even after the new protections from the Civil Rights Act of 1964, Hospitals once reserved for Black families remained under-resourced, and Black women did not get the same support regularly available for white women. That history of abuse and neglect led to deep-rooted distrust of healthcare institutions among communities of color. So think about American Black culture. And forgive me if I don't say our American Black culture, because I'm being respectful to American Black culture as an institution that stands on its own 2 feet, coming, from a Jamaican family, right? I was born abroad and moved to the States when I was 5, and I am now a naturalized US citizen, and I'm a mixed race woman, right? So I want us to think about American Black culture. I have the privilege of saying that I grew up and went to predominantly Black schools from about age 11 onwards. So I want us to think and ponder on American Black culture. Black American people are stereotyped as having an inherent distrust of medical professionals. And it's such a negative, funny stereotype, like, Black people don't trust doctors, Black people don't go to the doctor, LOL. Did we ever stop to ask why that's the case? Did anyone ever stop to ask that? One glance at American history should motherfucking tell you why that's the motherfucking case. If discrimination existed in housing practices, if discrimination existed in educational practices, then of course discrimination would have existed in medical practices. And between men and women, who are the people who are most likely to get pregnant and experience childbirth? Women. So if Black people were experiencing discrimination on all fronts, then Black women were experiencing that discrimination and medical discrimination when trying to seek pre- and perinatal health care. It tracks. The facts back it up. The stats and the facts do not lie, people. So examine where that stereotype comes from, that Black people are distrustful of medical institutions. Why shouldn't we be? What the fuck? If you grew up in a household where you were abused or neglected by authority figures, you are naturally going to grow up to become an adult who is inherently distrustful of authority figures, right? We understand that, right? Okay, when I was a kid, I had a rough childhood. I had a rough adolescence. We understand that. We can connect those dots. That's not a stretch to think about that. But it's a stretch to understand why Black people are distrustful of the medical establishment, why Black people are distrustful of the criminal justice system, why Black people are distrustful of corporate America. Think. Think. I also want us to remember that these differences exist regardless of educational or income level. What did I say earlier? Serena motherfucking Williams, the GOAT of female athleticism, and Beyonce, who needs no further introduction, experienced these racial health disparities when they were pregnant and when they were looking to give birth. So if their income couldn't protect them, then what? If statistically, I don't have children, but I am a woman with a law degree, a mixed race Black woman who is college educated. Statistically, my education can't even protect me either. Because in fact, according to, the Associated Press, Black women who have a college education or higher have a pregnancy-related mortality rate that is more than 5 times higher than that of white women. Be so fucking for real right now. So college-educated Black women, our degrees aren't getting us paid more. Our degrees aren't netting us better romantic partners. And if you decide you want to have a baby and become a mom, now your degree can't even protect you from experiencing severe pregnancy-related mortality. You're 5 times more likely than a white woman with your college degree to experience pregnancy-related mortality. Excuse me? I beg your fucking pardon? I beg your pardon. Please say psych. Notably, the pregnancy-related mortality rate for Black women with a college education is 1.6 times higher than that of white women with less than a high school degree. Be so for real. So Black women with a college education is 1.6 times more likely to die or experience a pregnancy-related mortality than a white woman who has less than a high school degree. These systems are so intentional. They're so insidious with how intentional they are. It's like they don't care about anything else. They only see your color, and based on your color, you're not a human being worthy of anything good or positive. That is so fucked up. That is so immensely fucked up. And it's okay, that's why I'm here. I'm here for these motherfuckers. I am here. Me and my mouth will never shut the fuck up. Okay, you can pry my feminist ass opinions from my beautifully manicured hands. Okay, I'll shut up. I'll shut up when the mountains fling into the sea. I will shut up when the sun rises in the west and sets in the east. I will shut up when the sky becomes the ocean. That's when I'll shut up about this. It's all right. I'm here. I'll talk about it. I'll talk about it. We also have to discuss how Black women in the South, the American South, are disproportionately impacted by maternal mortality, because we have to remember more than half of the Black women who live in the United States are concentrated in the American South. In the state of Alabama alone, the infant mortality rate for 2021 was 7.6 deaths per 1,000 live births. And that's according to data from the Alabama Maternal Mortality Review Committee in 2020. The disparities between Black and white babies in the South is stark, because the infant mortality rate in 2021 for white mothers was 5.8, compared to the infant mortality rate for Black mothers being 12.1. So 5.8 for white moms, 12.1 for Black moms, an increase from 10.9 in 2020. Black babies account for just 29% of births in Alabama, yet also account for 47% of infant deaths. Black babies account for just 29% of births, but make up 47% of infant deaths. I'm sorry if I'm repeating these things, starting to sound like fucking Dr. Umar Johnson, who repeats things over and over again. Let me stop. Let me leave Dr. Umar Johnson alone. But it bears repetition though, because it's some fucked up shit. A 2020 report by the Alabama Maternal Mortality Review Committee found that more than 55% of pregnancy-related deaths reviewed in 2016 and 2017 in pregnant women in the state of Alabama could have been prevented. Out of everything, that's the statistic that kills me the most, is that most of these pregnancy-related deaths are preventable. The fact that most of them are preventable tells me and lets me know that the Black maternal health crisis in the US is completely 100% intentional. Because if it's preventable, then why is it not being prevented? Questions that need answers. So this is preventable. We don't have to live like this. Black pregnant women don't have to die, and Black babies don't have to die. So then what's the problem? Why are we preventing it? Because these motherfuckers are racist. They're racist and full of shit. And by the same motherfucking token, they're talking about low birth rates. By the same token, statisticians and all that shit are worried about the census reports showing the declining birth rate and the declining workforce rate. How the fuck do you expect people to bring children into this world if Black women are dying from preventable causes while they're pregnant? Public policy has failed us and is continuing to fail us. Failing to protect us. Failing to protect our babies and our children and our bodies. Like we're disposable, like we mean nothing. I remember watching my mom struggle to raise my sister and I by herself as a single mom. And one of the starkest things that stuck out to me during that time was how I used to watch other women of other races who had children and who seemed to be enjoying their lives as mothers. They, received so much fulfillment from raising their children. And my mom enjoyed being a mom too, but she struggled to fulfill her duties as a mom, not because of her own choices, but because of these larger systemic and institutionalized issues that plagued her and thus plagued my sister and I. The biggest one, of course, being poverty and economic instability, followed by interpersonal violence. I used to watch my mom endure that. I used to say and think to myself, Now, how is that fair? Is my mom any less of a woman than these other women are? Than white women are? Is she less of a mom than white moms are? Is she less of a human being? Does she not have goals and hopes and dreams? Does she not desire to be a hands-on full-time mom who can spend as much time as possible with her children and give them the best that life has to offer? She's not a woman either. She doesn't matter either. Her life, her desires, her children don't matter either. Why? Because of the color of her fucking skin? That's all it takes? The amount of melanin that her skin as an organ contains, and that alone is what you determine and base your ideas off of and base your public policy and treatment of her off of? Get the fuck out of my face. And this is exactly why I'm a loudmouth, okay? In addition to being a bad bee with a law degree, a bad bee with a sociology degree, I am also the firstborn eldest daughter in an ethnic household. So you really know that my mouth does not give a fuck, okay? I am my father's last child, all right? Because he sowed his wild oats on all 7 motherfucking continents. Typical Jamaican man, all right? So I am my father's last child. I am also probably the son that he never had. That's how he acted and treated me when he was sober and sane. All right. So in addition to being a firstborn eldest daughter in an ethnic household and being the firstborn granddaughter and the oldest of 9 grandchildren, how many fucking cousins and shit that I've raised and whatnot, and my law degree and my sociology degree, I'm not shutting up about this. My lived experiences combined with the academic knowledge I have that informed and helped to explain those lived experiences, I can guarantee you I'm going to speak about this until the end of my days. And even after the end of my days, let my legacy be that I opened up my mouth and said something and spoke up. That will be my legacy, and that brings me comfort. All right. And I want you to also experience comfort as well, because I've talked about some very heavy topics during this episode, and I presented you with so many problems and so many statistics and so many facts and so many studies and so many quotes. Now I want to present you with solutions that our lawmakers and that the people who run these institutions are perfectly capable of enacting. The first solution is improved access to care and coverage. Expanding Medicaid and ensuring that all states have expanded Medicaid to cover postpartum care for at least a year after childbirth is crucial, because many Black women, especially Black women in low-income communities, face barriers to affordable care. Expanding telemedicine by increasing access to virtual health care for prenatal and postpartum care, particularly in rural or underserved areas where Black women face geographic barriers to care. All right, addressing implicit bias and cultural competency in healthcare. We need mandatory anti-racism training. We need better representation in healthcare, and having better representation in healthcare absolutely requires removing the barriers and restrictions that block Black women from being able to work in healthcare and achieve the required educational credentials, training credentials, and certifications to work in healthcare. So encouraging and funding initiatives that increase the number of Black doctors, nurses, midwives, and doulas to improve culturally competent care and build trust within Black communities. We need more community-led support systems. We need doula and midwife support. We need to expand access to trained Black doulas and midwives who can provide continuous emotional, physical, and informational support during pregnancy, labor, and postpartum. Doulas can also help advocate for women in medical settings and bridge the cultural gap. We need peer support networks, and that will help create mentorship programs where Black mothers can connect with other mothers who have had similar experiences and offer emotional support and advice. We need community health workers, and we need to establish community health worker programs that involve local individuals who are trained to provide culturally relevant education and resources to Black women throughout the pregnancy and the birth process. We need systemic healthcare reforms. We need to implement patient advocates and care navigators to ensure Black mothers are fully informed of their rights, options, and complications. We need health equity audits We need to require hospitals and clinics to conduct regular audits on healthcare outcomes to track and address disparities in maternal mortality and morbidity rates by race. Data that is tracked should be disaggregated by race, gender, and other demographic factors. We need to address the social determinants of health by providing support for housing and nutrition, comprehensive supports to ensure Black mothers have access to safe, affordable housing, nutritious food, financial stability, transportation during and after pregnancy. We need to have workplace protections that are strengthened for Black women, including paid parental leave, workplace accommodations, and protections against discrimination. We need to perform better research and data collection, and we need policy change and advocacy. We need to push for federal legislation that specifically targets racial disparities in maternal health outcomes. This includes measures such as funding for community-based interventions, support for Black-led maternal health organizations, and incentives for hospitals to reduce disparities. And we need to completely rehaul our reproductive justice framework. We need to advocate for a reproductive justice approach that focuses not only on access to healthcare, but also on economic, environmental, and social conditions necessary for Black women to have healthy pregnancy and birthing experiences. I hope this episode of Alexandra Unfiltered has opened your eyes, has educated you, and has taught you something new. And I hope that it has lit a fire in you to speak up for Black women and to listen to Black women and to protect Black women. I hope that it has inspired you to advocate for Black women, Black mothers, and Black pregnant women, to your lawmakers, to your medical health care professionals within your network, to anyone who has ears and eyes, basically. I hope this has done that, and I hope you are beginning to see how the Black maternal health crisis, the feminization of poverty, period poverty, the gender wage gap, the gender health gap, the racial wealth gap. I hope you are beginning to see how all of these systems interlink and work together to oppress women. Thank you so much for listening to this episode of Alexandra Unfiltered. I'm so happy that you were here today. Please tune in next week, Thursday at 8 p.m. Eastern Standard Time, wherever you get your podcasts from, to listen to next week's episode, where I will again lead you down the primrose path of patriarchal pitfalls. Until next time, bye-bye.